is considered as a systemic disease. That means it can affect any organ in the body. The symptoms of the lupus can vary from person to person because it varies depending upon the organ which is involved. However, the common symptoms of the lupus are the skin rashes, joint pains, frequent ulcers in the mouth, excess hair loss, fever for a prolonged duration, and so on. Coming to the skin rashes, the common type of the rash that we see in lupus is called butterfly rash or a mala rash, wherein you may have a red colored rash over the cheeks and the nasal bone, and these rash typically may increase in severity when you go into the sun. Other than this butterfly rash, you may also see some kind of rashes anywhere over the body, over the hands, over the legs, over the abdomen, over the chest. And coming to the joint pains, lupus patients can also present with joint pains wherein they can have joint pains in the hands as well as the wrists, elbows. Sometimes they can also have swelling in the joints, and the joints feel stiff, especially in the morning when they get up. And they may also have excess hair loss and frequent ulcers in the mouth, in the buccal mucosa or in the palate. Some can present with very low WBC count or platelet counts and very low hemoglobin also. So basically they'll be having low hemoglobin and low platelets, and they won't be responding to any kind of supplements or the transfusions. Here what happens is because of the antibodies, they try to deplete the WBCs or the platelets that are already happened, so they won't be able to replenish the hemoglobin levels or the platelets even after the transfusions. Other than this, some patients can also have internal organ involvement like the kidney involvement, wherein they can have loss of protein in the urine. Initially they can just be seen on the routine urine examination. Over some time they may develop swelling in the feet and swelling of the face when they get up in the morning, and they can also have chest pain when the lungs are involved, especially in the rib cage. In the side of the ribs, they may have chest pain, and which increases when they actually breathe in and out. Some can have neurological involvement. They may present with convulsions or weakness of one side of the body or weakness of the face. And some can also have shortness of breath and swelling of the legs when the heart is involved, and so on. So the symptoms, they may not be present at one point of the time. That means all of these symptoms may gradually develop over some time, and these symptoms varies from person to person.